Good morning, everyone, and welcome to our fourth lecture. So in this lecture, we're going to deal with the two next routines, one of them all based around sleep and our nap times, and the other based around toileting and nappies and so on. So first of all, an acknowledgement of country. I'd like to acknowledge the traditional custodians of the land, the Noongar people, and pay my respects to elders past, present, and emerging. Beautiful artwork from Marley Albert, and her art is featured in a number of different art galleries, and she sells her art, and she specialises in pieces with Australian wildlife and turtles and crocodiles and so on. Just beautiful. You can clearly see the oceans and the rivers and the land connecting with it all there. So our plan for our lecture: care routines based around sleep and toileting, sustainable practices, particularly around toileting, and links to our ASEQA and our EYLF. So let's delve into sleep to start with. So we know that sleep is essential for all of us. You can read a little bit more from the Health Direct website, but healthy sleep means that we're getting good quality sleep with regular sleep routines, and that's for children all the way through to adults. It's essential for our growth, our immunity, and our learning, and it's where children recover from illnesses and injury and where they heal in different ways. We know that if we don't get enough sleep, we're grumpy, and children are very grumpy. It's also linked to mental health problems, poor growth, and reduced school performance. So let's have a think. What are some general sleep guidelines? So for infants in the age range of 4 to 12 months, because we know that for the first few months of their lives, they're getting into a sleep routine, so it's not as clear, they will be sleeping more. But our recommended hours of sleep is 12 to 16 hours. That's a lot of time that babies are asleep, and they need it. Now, that might not be 10 hours at a point of time going all the way through the night. We talk about when babies sleep through the night, that usually means that they're doing more than 5 hours at a time. But to do that, there's so many variables that make it work for them. Some of babies will have lovely long 2 and 3 hour naps during the day, and other babies will have much shorter naps. As they move to be a toddler, they will have slightly less sleep. Some toddlers need a little bit more if they've got a really active life and they're at childcare each day and so on. They do get very worn out and they'll sleep a long time at night. So 10 to 14 hours. Preschool children, they then move to be the 10 to 13 hours. So you can see that it's not vastly different. They still need lots and lots of sleep. And school-age children still need 9 to 12 hours. But of course, when they are in standard school from 6 or 7 years of age, they're not having naps during the day. So their sleep will be mainly at night. So it's important that we allow lots of time for children to sleep, and we help parents understand that having their child go to bed at 11 o'clock at night and expecting them to be able to wake up by 7 in the morning and to be able to function for school is not appropriate. So sometimes we just have to help parents understand why sleep is so important. And I often include it in parent meetings when I'm doing my beginning of the year or end of the year, depending on when you do your parent meetings. We talk about having good sleep and that they need to be up and ready for school at the time that school starts. So when you move into childcare, we have to understand how we settle children and what they need in order to sleep safely and effectively. So sudden infant death syndrome is a particular, I won't say disease, but yeah, it's the name given when there's an unexpected death of a baby. Now, we used to call it cot death because, unfortunately, parents would go in to get their child up from a night's sleep or a day's sleep, and unfortunately, the child has passed. So what was developed probably back in about the 80s and 90s was some really good safe sleeping practices, and that they worked out certain things if they changed the way that we put babies to sleep, the environment that they were sleeping in, the clothing that they had to sleep in, that it made a massive difference in the survival rates. And it really reduced the amount of deaths from small children from SIDS. Now, in a childcare setting, you are the people putting the babies to sleep. You are controlling the environment and so on. So what we know is that we can prevent lots of things by having the appropriate safe sleeping practices. So the causes of SID are unknown, but what they know is that it's usually based around the ability of the baby to know that it needs to breathe. So it usually goes into such a deep sleep that it literally doesn't rouse itself enough to know that it needs more oxygen and to sleep, and then to breathe while it's sleeping. So when babies sleep face down, we know that they might rebreathe exhaled carbon dioxide. So when we are in childcare, and at your own home as well, there's three main areas that you must consider. So you've got to think about the environment. So that means the cot, it means the temperature, the amount of light, and so on that you have. So safe sleeping practices mean that in your environment, the cot should be just a mattress. There shouldn't be bumpers around the cot that are like the little pillows all the way around the edge and so on. That your environment shouldn't include pillows for babies. They don't need pillows. They need to be placed flat on their backs and not to have lots of blankets, doonas, all those sorts of things. So very much you think about the environment and how it's placed. You also don't want too warm an environment. That's one of the other risk factors, that the babies, they then are not able to monitor themselves effectively enough. Now, the placement of the baby is when we put the baby down to sleep. So we've already said that if they are face down, they are unable to turn over, so they can't flip themselves over. Once a baby can flip itself over and do a turn and so on, they're at less risk, but they're still not at no risk, because sudden infant death can occur up until sort of 18 months, 2 years sometimes. So we need to make sure that we're placing the baby down to sleep on their back, and that they are placed not near anything that when they do roll over, they could roll themselves in between, say, a cot bumper and the cot mattress, and then they're suffocating their faces and so on. So when we place them down, we shouldn't have soft toys, all those sorts of things shouldn't be in the cot. The clothing that they should be in should be something that they have some movement, but not so loose that they can pull it up over their heads and so on. So you'll see things like the sleeping bags and so on that are little zip-up ones with arms in them. You'll sometimes see babies swaddled, and we'll talk about that in the tutorial. So the clothing that you place a child in, we obviously also want to make sure that it keeps them warm and safe and isn't a fire hazard, but it also shouldn't be a choking hazard, it shouldn't be a suffocation hazard, and so on. So those three things, there are many, many aspects in the safe sleeping practices that as an educator you need to be aware of. So let's have a look at what ASEQA says. With our routines, so educators should have a good understanding of your policies and procedures and embed those practices in. You've got to think about what are the potential hazards and remove those. We need to make sure that we document their sleep and rest needs and provide that information to parents. So you record when you pop them down to sleep and when you pick them back up again. You make sure that parents are well and truly informed of that. You're always making sure that you model and promote some good safe sleeping practices. So we put them in the right clothing, we lay them down the right way, we make sure that the cot is cleared and so on. Now, there is a dot point there with just above those green dot points where it says maintain supervision of sleeping and resting children, including regular physical bedside checks, including visual inspection of the child's sleeping position, skin and lip colour, breathing, body temperature, head position, airway, face and neck. So that means that you don't leave the children unattended until they wake up again. It means that you have a schedule. It might be every 15 minutes that you pop in. It shouldn't just be a monitor that you're visual as well. You should actually, it says there, regular physical bedside checks. So even if you've got a monitor that you are watching them, somebody needs to go in and physically check on each of the children who are asleep to make sure that they haven't managed to wriggle themselves anywhere, that they haven't stopped breathing even though you've put them in the right position and everything like that. So you make sure that every child is sleeping safely. And it's our responsibility to ensure that. So you'll see there the things that I've just mentioned. The sleeping spaces have adequate light to allow supervision, so you don't want it pitch black. You make sure that the clothing is appropriate, and you make sure that you report any issues to the nominated supervisor. So we do have sometimes our students at uni who know that safe sleeping practices are not being followed at their centre, and they have asked myself or Tracy or Kelly, somebody, what do they do? And then we say you have to report it, because your centres must make sure that they are following all of the correct routines. You do not want a child to pass away because of inappropriate practices. So when we look at the policies that are required, you've got things that you must include in all of the procedures. So you've got to make sure that you are clear about where is the bedding stored, how are the cots and beds made, what's the cleaning processes. You make sure that all your cots comply with Australian standards. You make sure you've got appropriate strategies for monitoring, implementing the procedures. So when it comes to the sleeping environments are fit for purpose, you make sure that you have done an assessment of the policies. You make sure that the spaces are well ventilated, the temperature's controlled, the lighting, all the other considerations are specific to your environment, and so on. So you can see that there's very clear identification of the related policies and procedures that you must follow. It's not optional extras. We're talking about sleep being essential for every child, but it's also a potential hazard time where children can pass away because we as educators may not do the right thing. So we have to make sure we are always following the safe sleeping practices. So when we think about it, how do we get a child to sleep when we're in a childcare setting? So we have a regular routine. It might be that you have floor time. You might have food, then floor time, and then we transition to sleep. Other times we might have sleep time, then we transition to a floor time, and then a food time, and then they may transition back to sleep. So we have certain things that go on during the day, and we make sure that we are doing calm activities prior to trying to get a child to sleep, because it is tricky. Now you may need some soothing pats, touches. There may be something that you do. You might be stroking their back, patting their head, patting their back in some way. But you do want to try and have a child that is self-soothing, that does not need to be rocked for half an hour before they fall asleep. So listen to what the primary caregivers say as to their routines they use. Oftentimes I will find that sometimes the child will be able to follow a different routine at home and at the centre. So that makes life a bit easier for you, but definitely you will need to have a routine that will work for most children. So I find most of the time in a childcare setting that gentle touches, nice calm time beforehand, popping them down, possibly if they're very young, a bit of swaddling. If they're not as young, then they might need a pacifier, they might need a blankie with them, their soothing toy of some sort, something, and then they'll drift off to sleep, because that's the routine that you've set up in childcare. Now, we've got food that we're going to be talking about in a couple of weeks' time. We've gone through the basics of our sleep. Then the next part is that floor time, where you're happening floor time either before sleep or after sleep. And what is floor time? Floor time is literally where you're popping the babies on the floor. You might have the little mobiles hanging over them. It's a time for them to have some time flat, and you might put them on their backs. You might put them on their tummies and then they lift themselves up and so on. But you want to give them some time that is independent floor time and some time that might be interactive floor time. Independent meaning that you're leaving them and you're a few steps away and that they've got some things and they're looking at the world around them, and then they'll try and flip themselves over and they'll be wriggling their little legs and arms and trying to get to things and so on, and then looking and listening at everything. And then you might have some interactive floor time where you're sitting down next to them and you're playing with them, you're holding things, you're getting them to turn over to reach their hand over the other side of them and so on. So good floor time that builds some good motor skills and development. It helps them develop a little bit of independence, so you're not holding them 100% of the time. It teaches them some simple problem solving, and it builds up their body self-confidence as well, that they can move and do different things. So when the babies are playing, they've often got, you put their favorite toys around them. They can learn some problem solving to try and reach them. So they'll really reach, and then at one point they'll accidentally scare themselves because they'll roll over and they'll actually get to that toy. And then they look at you with this absolutely massive smile because they're so proud of themselves. So you can see that that is such an important part of their development. And as a childcare worker, you need to give them those opportunities as well. But you need to do it in a safe space. So sometimes they'll be seated somewhere, and sometimes you want them to have floor time. As I said, sometimes on their back, sometimes on their tummies. So when we're thinking about this idea of routines, where does floor time fit? You will have feeding time, floor time, sleep time. They are the different points during the day. Floor time might be right where you are next to them, but it could also be where you're carrying them and so on. That will be added into it. So floor time's where you're not attached to them, but then there'll be other points where you will need to be holding them, and you'll often have little slings and different things like that. So you'll have different routines for the different stages of the babies. So now, moving on to our other routine that we have, toileting. So babies are obsessed with their body needs. So toileting overview. Babies will use nappies for the first few years of their lives, and caregivers, we are responsible for changing and maintaining all of that cleanliness. Learning to use the toilet or a potty is really an essential part of development for toddlers. Now, you will hear some information that talks about toilet training and some information that talks about toilet learning. Toilet training, we often term as something that the adults direct. Toilet learning is when the child is really involved in their own learning. So toilet training might involve a bit of a time pressure, but it can have some consequences. So you've got to think about how you can help the child to understand what their body is telling them and how they respond to what their body is telling them. And that's where we've got this idea of toilet learning. So learning that signal from their body is then followed by a release of urine of some sort. That the signal from their body gives them the urge that they need to remove waste from their body in some way, and they need to do it somewhere. You will start to notice that babies who are in nappies, they'll start to tell you that they've done a poo. They'll use their words or they use their actions in some way, and sometimes quite early. And it's up to us as the adults to look at how we can help them to then transition into using a potty or a toilet, whatever is appropriate in your different environments. So at the beginning, you will have very clear nappy changing guidelines. So there is quite a lot of information under that. So have a look at your ASEQA guidelines quality area 2. They have entire documents based around effective toileting and nappy changing procedures. Now, when we are doing this, we need to make sure that we are doing the best thing for the child and making sure that we're doing the best thing for ourselves as well. So we should always be reflective of health, hygiene, and safety. Safety to make sure that they're not able to roll off the change table, safety to make sure that we are not putting ourselves in compromising positions with naked children. So you have to be very conscious of all of the policy guidelines. Now, educators, we must ensure that our toileting and nappy change routines are conducted in a ways that we maintain good hygiene, and really important that we have interactions that are warm and responsive, because nappy changing is quite a beautiful time. I know it sounds gross, but it is quite a beautiful time. You have to touch the children, you have to wipe them, you need to talk to them, interact with them, sing silly songs, do things that will keep the child happy, and so on. So you want to make sure that you are really connecting with the little people that you have around you at any point in time. So when we're thinking about nappy changing, as I think we discussed in our tutorial, we have to think about how many nappies are we using, what is the centre guidelines and policies regarding disposable versus reusable nappies, what are the centre guidelines regarding, are they centre provided or are they caregiver provided, and what wipes are you using and what cleaning products are you using. So a lot of these things are not sustainable. So think about and make good decisions at a centre-based level to show how are you ensuring that you are being sustainable in the way that you use all of these products. What are you doing to make sure that you are not being wasteful? So are we always using wipes? What are we doing with the wipes? There's different brands that you can buy that are a little bit more environmentally friendly, the same with nappies. So think about all of those sustainable practices. What are you building in and how are you making sure that they are all followed? So when it comes to toileting, we have to think about what are the changes that children will go through. So first of all, we want to wait to toilet train your child until they show signs that they're ready. Now, most of the time in Australia, this will be around 18 months to 3 years of age. So you want to be patient and relaxed. Don't make a big deal. And they are going to make accidents. So having extra clothes in their bags and really reinforcing that with all caregivers that dropped them off, very important. So you might create a regular schedule where you start putting the children on the toilet or the potty at regular intervals, and then they'll start to tell you that they need to go. But they might not use words, they might use actions of some sort. They might go in a particular place in one around the centre and so on. Now, while you're doing things, you teach them good hygiene. So while you're doing nappy changes, you might just use the words, help them to understand they have to wipe their bottom, help them to understand the difference between the way that you need to wipe from front to back so that you're not spreading germs from one place to the other. And being aware that staying dry and being toilet trained is often only done during the day, and then they might need nappies at night. So toileting is a lovely way to connect with your primary caregivers. So I find that having a good conversation with the people that drop them off about the types of clothes. So as a child is learning to toilet train, you don't want them in overalls. Overalls are a bit tricky for little people to undo by themselves. So you want them in a pants or skirt that they can quickly pull down or pull up, and then they can get to their underwear or their nappies very quickly, and so on. When you are thinking about what you do in your centre, talk to the parents and find out what do they do at home. So what are some words they say and so on. So you want to try and connect your routines together so that you are not going against one another in any way. Now, in your centre, make sure that you have carefully thought about the position and location of your taps, your toilets themselves, door handles, make sure you've got good visibility and so on. So if it's not working, have a conversation with your centre managers. There are safety guidelines that most centres have followed. I find it's more at home that we don't have the right things in place for it in some way. Now, as I was doing a little bit of research, I found out some different things about our cultural differences. So in Australia, we generally keep our babies in nappies, and they're about 2 or 3 years old, as I said, before they learn to use a toilet. But other cultures, quite different. So nappies are sometimes in different places around the world barely used. And toddlers are fully potty trained. That is, they can tell you in some way that they need to go to the toilet once they're old enough to walk and can take their own clothes off. So one of the bloggers that I was reading, she said in Palestine, this is as early as 14 months old, and in other countries, 12 months old. China, for example, often is very early as well. I found really cute pictures in China of these kind of nappies that had big holes out the back so that the children could quickly sit down. So they're training pants, and as soon as they were walking, they were able to make themselves off to the toilet to do what they needed to do. So be really aware with different cultures, they might require different ways for you to deal with toilet training. So cleanliness and toileting. So basic rules at a minimum. We wash hands before changing. We wash hands after changing. We clean all of the areas after changing, so that way when the next person comes into that nappy change area, that it is clean. You dispose of all the waste appropriately, and by appropriately, it means whatever is your centre guidelines to meet the sustainability or the general waste guidelines that they have. With children, we teach them hand washing, and that can even be from very little, that even though we're changing their nappy, we're getting them to wash their hands afterwards as well. We talk to them and teach them about how to wipe their bottoms and vaginas and penises appropriately. We teach them about flushing. A lot of children are very scared of the flushing toilet, but we need to make sure our toilets are flushed. We teach them how to manage their clothing, and again, we make sure their clothing is appropriate in the first place. So all of those things, very important as we are going through what they need to do. So our toileting and nappy changing fits under our health and safety in our standard 2, and our physical environment in our standard 3. So when we're thinking about it, we've got lots and lots of principles and practices that come under quality area 2. And then under quality area 3, we want to make sure that we are thinking about how we design our environment and how we use it to make it inclusive for all of our children. So think about what and how your environment is designed, as well as how we can build in those sustainable practices for it. So a quick review. Sleep is absolutely essential for all small children. Good routines make this much easier. We have safe sleeping practices. These are not negotiable. They must be followed. You do not want to be part of a centre that has not followed those practices, and some awful tragedy has happened. Nappy changing, we've got health and safety guidelines, plus we also have our code of conduct about what we do as adults and so on. Toileting, we have the notion of centre cleanliness, but also we focus on the child and their hand washing and cleanliness routines. And both of these routines map into our quality area 2 and quality area 3.